This is Shani Caviness at HKV Surgery, live with you today with one of my besties, Christy, who is willing to be a model for me today with the CO2, the CoolPeel laser that we're demoing today. So with Christy, typically we don't even have to numb for this CoolPeel. She was concerned about her wrinkles, her brown spots, with generalized aging. Now the beauty of the CoolPeel is this can be used at 20, 30 years old, or just a general resurfacing with the lit from within glow. Now once we age a little bit further, we'll have deeper lines. This machine offers me the opportunity to select which is best for the patient. There is a light, medium, and deep mode. Sometimes I choose a light mode for a lot of the surface area, but when I see the deeper lines around the mouth, I'll go deeper for that area. Like I said, typically we don't numb for this, so you can walk into the office, have your treatment, and be out within 30 minutes. The follow-up to that would be just a nice lotion, like a CeraVe or Cetaphil, something gentle to the skin with just gentle cleansing at night. And with that, you'll notice almost a sandy texture occurring with the skin. And over a week, it will have completely cleared and become more smooth. Now with the CoolPeel, because it is a lighter treatment, you'll want to do a series of 3. This would be one approximately every 4 weeks. The deeper the treatment, the less often you have to do it. So for example, if I went super heavy on her entire face, she would have it once a year. So there are benefits and drawbacks to each. If you do that deep once a year, you lose your ability to maintain your water balance in your skin and to prevent infection, so you use a layer of Aquaphor on the skin. Aquaphor with a mask can be a little tricky these days, but a lot of us are working at home, and that leaves that potential to be out of the spotlight for a week. So whatever suits you, we can do. So today, because I will have some of the deeper treatment, I did have Christy numb prior to, but generally you really don't feel anything at all, and I can demonstrate that on her hand before we get going today. Now, she has been cleansed, she has no makeup. When you have a CO2 laser, the laser is attracted to water in the skin. So I want to wipe her skin with alcohol first to get it as dry superficially as possible to get a better result. Is that okay? Now, with any laser procedure, you should protect your eyes, both the patient's and the person performing the laser. So I'm going to be applying these stickers to her eyes so that we don't get the laser causing eye damage. Now, I like to leave them get some extra skin at the bottom, that lower lid. Tends to get crepey as we get older. I still can pull that down and laser that area to help treat that as well. All right, are you ready?
I'm ready.
So first I'm going to show her what it feels like to have the CoolPeel application on her hand so she can tell you what this feels like. All right, I'm going to get on my protective gear. And the laser, this is what the laser looks like. This is to help maintain the space from the laser, the accurate spacing, and you'll see the square that's formed. We can actually change the size of our square and our shape to fit the actual patient's face. So you'll see that we don't need it that small. Okay? So, we are going to, you're going to hear a sound of buzzing. And I'm going to have you put your hand here.
I can't see.
In my hand. I'm sorry.
Okay.
You can't see. So I'm going to apply this to her hand, and you're going to hear a beep and just a little tinkle sound. Ready? And how was that?
I mean, I barely even noticed.
Excellent. So as you can see, her hand was not numbed, but for the basic peel for 20 to 30-year-olds, or if you want to do the series of treatments once a month, this is what we would do for your face. This little white cross-hatching here, well, you won't even be able to see it by the end of the afternoon. You would appear pink and just a little sunburnt for less than 24 hours. So it's very easy. You can get back on your Zoom call within a day. Now we're going to start with her forehead. You can see all these brown spots. I'm looking forward to doing follow-up pictures on this because all these brown spots are going to clear up. So you're going to feel a little spicy here. How was that?
Nothing.
Excellent. So we would just continue to build the grid across her face. And once again, this is going to help all these deep lines, the brown spots. Once we get to her nose, the pore size. And the best part about a laser is it's not just working topically. This actually extends its pores down into the skin to induce collagen production. When you produce collagen and elastin, it helps your skin stay healthy and not have that fallen face look over time. So I do recommend doing this once a year. So an easy way for general maintenance of the skin, I would combine this with Botox to help reduce the wrinkles. You can do fillers with it. And you may even consider microneedling monthly in between your annual treatments of laser to help continue to build collagen. Lots of fun things we can do with lasers here. There's always a way to reduce your lines, to reduce the discoloration, to help the pores and maintain that youthful glow. So consider the CoolPeel or the CO2 laser for your next treatment. I'm Shani Caviness. You can see a lot of my results on Skin, Body, and Soul by Shani on Instagram, and I'd love to see you here soon.